Thank you. My apologies for the delay. I know we invited some students from our 4 high schools, and we had some traffic issues, but nevertheless, we're here today. I'd like to welcome you to the Student Activity Complex. My name is Bobby Cruz. I'm Director of Athletics, and I'm the co-chair, along with our co-chair back there, Ms. Roxanne Robledo. And if you've been with us before, welcome back. If you're new to us and you're wondering, what am I doing here? What's this all about? That's what we're going to go through today for our first meeting. So let me jump into this because we want to be quick and efficient. And so this is the second year that we've been assigned to lead the UISD School Health Advisory Council. And we call it the SHAC. So this is our SHAC committee. We hope that you can continue to be a part of our committee, because this committee is very important. All right. The children and youth who begin each day as healthy individuals can learn more effectively and are more likely to complete their formal education. Responsibility for the physical, emotional, social, and mental, intellectual health of everyone belongs to their families and our entire community. Effective coordinated school health programs and curriculums contribute to helping young people by avoiding health risks, by increasing their skills to make responsible choices that can affect behaviors and affect their health. UISD has established an advisory council to advise the school board, and that's what we're going to do. Our role is not to create policy, but our role is to advise our school board on what we'd like to see. It will assist the district in ensuring that local community values are reflected in the district's health education plan. The advisory council will advise and support the school's efforts to assess their needs, and it will design programs to help children develop the knowledge, skills, and attitudes they need to become healthy, productive citizens. A SHAC committee is appointed by the school district, invited by the school district, and its programming can affect all students and their health and learning. So what are the duties of the SHAC? As a member of the SHAC, you will be involved in discussions, and important discussions, such as school nutrition, activity and fitness, mental health, human sexuality curriculum, bullying, suicide prevention, physical health concerns, substance abuse, counseling programs available to students, promoting a safe and healthy environment for all students, and strategies to increase parental involvement. Who are the members of the SHAC? The law states that the Board of Trustees can appoint at least 5 members of the SHAC, and we have a couple of people that were appointed by the board, and unfortunately they could not be here today. They canceled, but we look forward to having them. The Board of Trustees may appoint also or invite persons from each of the following. We can have classroom teachers, which we do have, school counselors, school administrators, and we like to invite school administrators that have children in our district. District students, healthcare professionals, medical or mental health professionals, business community, law enforcement, senior citizens, the clergy, nonprofit organizations, and local domestic violence programs, just to name a few. So it's a wide range of people from our community that we can invite to our committee. This year, our committee is required to meet 4 times a year, and we'll get you the dates. This is our first one. Actually, we moved it up. In front of you, when y'all walked in, you were given some literature on the SHAC committee, our agenda and a handout. So you could take that with you. And it's just basic information on what I just covered, a little bit in more detail about what our SHAC committee does. And so basically, it's our responsibility, and we invited students because we want to hear from community members, health agencies, parents, and students who are at our schools, especially our high schools, items that concern them, things that they would like to see, anything that they want to recommend to the board for us to consider. A lot of our students that we have here today from our 4 high schools belong to our superintendent's advisory committee. And they also have some input with our administration on policy. Okay? So our meetings, what we choose to do is we choose to isolate maybe, our first one is always an introductory meeting, and we'd like to isolate 1 or 2 topics that as a district that we're covering or that we're considering, okay? Today, we're gonna talk about, we will have a presenter from our guidance and counseling department, Ms. Michelle Gonzalez. I was gonna say Barrera because I know her as Michelle Barrera. Yes. And then after that, we'll have a presentation from Region 1, and then we'll adjourn. And by all means, if anybody has any questions before, during, or after the meeting, feel free to ask me, Ms. Roxanne, and then we'll go from there. Okay? Before we bring up our first presenter up, I'd like to take a moment and just go around, introduce yourself, tell us where you're from, real quick. Bobby Cruz, Director of Athletics, SHAC Co-Chair.
Michelle Gonzalez, I work for the Guidance and Counseling Department as a coordinator.
Adriana Ramirez, I'm the Executive Director for Federal Programs.
Hi, good morning, Arlene Marin, and I'm the Education Director for Students and Global Foundation and a nonprofit organization.
And I'm Leanne Gutierrez, I'm a Human Trafficking and Prevention Education Specialist at Region 1.
I'm Ruth Aguilera, I'm also an executive in Region 1.
Good morning, Alma Castillo, LPD parent.
Thank you.
Michelle Cantú, Principal at Amparo Gutierrez Elementary.
Good afternoon, Christina Duarte, Health Promotion Manager at the City of Laredo Health Department.
Hello, Alejandra Rodriguez. I'm from the City of Laredo Health Department. I'm a program promotional specialist.
Denise Palacios, I'm Secretary to Associate Superintendent for Curriculum Instruction, and I'm also a parent of a high schooler at Alexander and a middle schooler at United Middle.
Mickey Esparza, United South, and I'm also Booster Club for United South as well as a parent.
Brenda Hernandez, parent of United South High School.
Nina Juarez, Discipline Management Facilitator.
Mary Lou Montoya, parent of an LBJ student. What's your name?
Amanda Montoya, I'm part of LBJ.
Hello, I'm Ramiro Tejerina. I am. Were you done?
Yeah.
Okay, I'm a senior at Lyndon B. Johnson High School, and I'm the president of the Future Health Professional Organization.
Good morning, my name is Jesus Trujillo, and I'm an 11th grader at Johnson High School.
My name is Amanda Lopez, and I am a health science teacher at LBJ.
My name is Sara Rodriguez, and I am a library aide at United South High School.
My name is Chloe Tovar, and I'm the sophomore class vice president at United South.
Hello, my name is Adam Rivas. I'm library club president for United South High School.
Hello, everyone. I'm Maris Rosas, and I am the junior president at United South High.
Hello, I'm Miriam Ortiz. I'm an employee at Elias Herrera, but also a parent of 2 high schoolers and 1 middle schooler at Elias Herrera.
I'm Marty Sarabia, UISD Employee Wellness, and I have 2 daughters at Colonel Santos.
Good afternoon, everybody. My name is Ariana Valdez. I'm the operations manager for the Child Nutrition Department at UISD, and I have a junior and a senior at Alexander, both boys.
Hello, I'm Michelle Barrera. I am a parent for 2 middle schoolers, and I am also an employee of the district. They confused me a lot with you. I was like, well, you're the one.
Good afternoon. Esteban Ayala, I'm a parent for schooler at Ricardo Molina, physician assistant in pediatrics, and former teacher and coach from LBJ High School.
Hi, I'm Courtney Jackson. I'm the Director of Purchasing. I'm also a parent to a junior at Alexander High School and a 7th grader at United Middle.
Hi, my name is Isabella Esquivel, and I'm the senior class 2024 president at United High School.
Hi, my name is Alexa Garcia. I'm the junior class president at United High School.
Hi, my name is Priscilla Sandoval. I'm the sophomore class president representing class of 2026.
I'm Eliseo Lopez. I'm a junior at Alexander High School.
Hello, I'm Blake Gaber, and I'm an alumni of 10th grade from Alexander High School.
Good afternoon, Patricia Esquivel, secretary to the counselors over at Alexander.
Thank you. Y'all, thank you very much for being here, especially our students. We want to hear from you. Last year, and parents, thank you for being here. Last year, at one of our presentations, one of our students said, I really want to hear about our menu and our food. Everybody wants to talk about that one. So the next meeting we had, we put that on the agenda, and Ms. Valdez spoke, and we had her on for 20 minutes. It ended up taking an hour. By the end of that meeting, everybody wanted a taste test, and we wanted to be invited to the menu show and all that stuff. But and like I said earlier, to us it's important. We appreciate you being here. As parents, the 4 meetings that we'll have this year, we can put anything you want on the agenda, anything you'd like to discuss, anything you'd like to see, any type of policy you'd like to see implemented, because you, as parents and students, you're at our campuses. You're at our campuses. And so any policy that we need to adjust or enforce or listen to, today we're going to have a presentation from Region 1 on what they have to offer curriculum-wise. We haven't done it, but this is what the SHAC is for. They bring it to us, they present it to us, and if it's something that we feel like we need to take to the school board or to curriculum and instruction, then we do that. And we give them our pros and cons, and we go from there. Okay, so that being said, the first person I'd like to bring up is from our counseling and guidance department to let us know October is an important month, and let us know what our guidance and counseling department is doing for our students. Ms. Michelle Gonzalez.
Okay, perfect, thank you. Hi, everyone, and good afternoon. I'm here today representing Ms. Melissa Ramirez. She is our director for the Guidance and Counseling Department. I'm one of her coordinators. Before that, a little bit about myself. I was a UISD counselor for 21 years, 7 years in elementary, and then I went 7 years to the high school. In elementary, I was at Kazin, and then I went to United South High School as a counselor. And then from there, I was a counselor at Antonio Gonzalez Middle School with Ms. Ramirez. So I've done all the grades, and I was given the opportunity to help lead the counseling department with Ms. Ramirez. And so I've been there 8 years. So this is the place where I've been the longest. She did call me last night. She had to leave out of town, and she asked me to please present this for her. So one of the things that is most importantly, or what is most important occurring in our community, we've been hearing a lot about fentanyl, and we do have our experts in our district, which are our LCDCs, that have been talking about that in the classrooms with our students. I am going to show you a little bit. First, the first thing, I don't know, can you all, let me make it bigger. This one. Let's see, I would want it to come out like the whole page, or no? Is that? I can just read it from here. That's not a problem. Okay. So, because fentanyl has become so prevalent, not only like in the United States, in Texas, and now, of course, unfortunately, we've been hearing a lot about it in our communities. The state has a bill, it's House Bill 3144, where the Texas legislature met, and it establishes the month of October as Fentanyl Poisoning Awareness Month, okay, to increase awareness of the dangers of fentanyl and potential overdoses. Okay, we've had a few overdoses here in Laredo. I don't know if you've all heard the news, but we've had some overdoses in the community. House Bill 3908, also through the 88th Texas Legislature, in 2023, it's known as Tucker's Law, adds to the duties of a school, so that would be UISD, right, to educate students about the dangers posed by the drug fentanyl and the risks of fentanyl poisoning, including overdose. Okay, for those of us that don't know exactly what fentanyl is, because, you know, maybe you may have not heard what it is. Fentanyl, I got some facts from the DEA's office. It says fentanyl is a potent synthetic opioid drug. It is approved by the Food and Drug Administration, but it's for use in hospitals, okay, for pain relief and as an anesthetic. Okay, but it is approximately 100 times more potent than morphine and 50 times more potent than heroin, okay? More recently, there has been a reemergence of trafficking distribution, the abuse of illicitly produced fentanyl, which increases the chances of an overdose, okay? Common names include, if you hear people talk about Apache, China Girl, Chinatown, Dance Fever, The Friend, Goodfellas, Great Bear, He-Man, Jackpot, King Ivory, Murder 8, and Tango and Cash. Those are all words to use when they're talking about fentanyl, okay? What does it look like? It could be oral, transmucosal lozenges, which are called lollipops. They can be tablets, sublingual tablets, sublingual sprays, nasal sprays, transdermal patches, and injectable formulations. So it could be all of those different things. Fentanyl is encountered either as a powder or in counterfeit tablets, and it can be sold alone, or it could be in combination with other drugs such as heroin or cocaine. So they are mixing, okay? Fentanyl can be injected, snorted or sniffed, smoken, taken orally by pill or tablet, and spiked onto blotter paper. Fentanyl patches are abused by removing its gel contents and then injecting or ingesting these contents. Patches have also been frozen, cut into pieces, and placed in or under the tongue or in the cheek cavity. Okay? It's illicitly produced. Fentanyl is sold alone or in combination with heroin or other substances and has been identified in counterfeit pills, mimicking pharmaceutical drugs such as oxycodone. Okay? What are the effects on the body? It can produce effects such as relaxation, euphoria, pain relief, sedation, confusion, drowsiness, dizziness, nausea, vomiting, urinary retention, pupillary constriction, and respiratory depression. The effects can be stupor, changes in pupil size, cold and clammy skin, coma, respiratory failure leading to death. Okay? So as a district, what are we doing as a district? It's okay. Yeah, we're going to go ahead and play the video.
Well, I'm a pediatrician who takes care of lots of teens and young adults who struggle with substances, everything ranging from nicotine and alcohol right out to heroin, fentanyl, and stimulants. And so I see a lot of different things. And what's really important for teens to know is that overdose deaths more than doubled during the COVID pandemic. And actually, it turns out that now 3/4 of all overdose deaths in teenagers are caused by fentanyl. Fentanyl is a really highly potent opioid. In fact, you may have heard of heroin before. Fentanyl is 50 to 100 times more potent than heroin. What that means is that it's really easy to overdose on it, and a lot of teens are dying from it. One of the big issues is that pills that are being sold on the street right now and being passed around among friends often are fake pills. They're counterfeit pills that have been made in somebody's home using a pill press and involving fentanyl in the production. And so it's really a case of you don't know what you're actually getting when you take one of these pills. And so I, as a pediatrician, have lost a number of patients to counterfeit pills. I worry a lot about this as a pediatrician, and I urge you, if you or somebody you know is struggling with opioids, reach out to a trusted adult. What that trusted adult can do is help connect you to pediatricians like me or other health experts who can do a couple of really important things for you. One thing that I do as a pediatrician is to make sure that all teens and families who know somebody struggling with opioids have access to something called naloxone. Naloxone is a spray that goes up the nose and can reverse an opioid overdose. The second thing that's important to know about is that pediatricians like me can help get people into treatment if they're struggling with addiction. And so please reach out, it's what we're here for.
So as a district, what are we doing as a district? Okay, so currently we have addressed fentanyl in one of our parenting sessions through one of our licensed chemical dependency counselors, Claudia Garza, this past Thursday at 11, October the 9th, at the Family Resource Center. And in addition, we're going to have some presentations at the Parent Learning Summit that's happening this November 11th. Okay. For our high schools, the opioid crisis team, which is comprised of the fire department, will be going into our UISD high schools to present on the dangers of fentanyl. As for our middle schools, our LCDCs, which are licensed chemical dependency counselors, along with one of our local agencies, SCAN, okay, will be presenting to all our middle schools on the dangers of fentanyl as well. And in our elementaries, our elementary school counselors will be providing age-appropriate fentanyl awareness sessions, as well as talking to them about the dangers of fentanyl. And lastly, the law requires a designated week about the dangers of fentanyl, and our district will be providing Red Ribbon Week and Fentanyl Awareness Week together. And it's one of these flyers I have here, Red Ribbon Week. So this is a flyer that's going to be from October the 23rd to the 31st. And we have this in all our district where we're going to be either, like, for example, on Monday, it's ready to stay drug-free. We're red to kick off Red Ribbon Week. On Tuesday, being drug-free is super, wear your favorite superhero gear. On Wednesday, it's follow your dreams, say no to drugs, wear your comfiest pajamas. On Thursday, team up against drugs, wear your favorite sports jersey. Friday, say no to drugs and yes to staying healthy, which is also coincides with breast cancer awareness. We're going to wear pink. Breast cancer awareness shirt will be on that day. And Tuesday, which is Halloween, drugs are trick, not a treat. One pill can kill. Don't make a deadly decision. Okay, so that's going to be for the week in all of our UISD schools. And then this is one of our fact sheets, okay, which is kind of what we've been, what we heard in the video. It's 89%. Increase in fentanyl-related deaths, 89% reported in Texas in 2021 compared to 2020. Okay, so the only safe medication are ones that come from a licensed and accredited medical professional. The DEA warns that pills purchased outside of a licensed pharmacy are illegal, dangerous, and potentially lethal. The number of fentanyl-related deaths in Texas has almost doubled in just 1 year. So last year in 2020, we had 883 deaths. Not last year, in 2020. In 2021, we had 1,672 deaths. Okay, so it's clearly doubled. Fentanyl poisoning is a leading cause of death for people ages 18 to 45 in the U.S. So here are some statistics compared to 2020 and 2021. 37,087, and in 2021, 40,010. And vehicle accidents, we have some other statistics. Suicide, 21,441. In 2021, 21,678. Over 150 people die every day from overdoses related to synthetic opioids like fentanyl. 99% of fentanyl overdoses are accidents. Fentanyl kills one person every 8.57 minutes. Okay, I won't read all of it, but just here so you can know as far as what Governor Abbott was involved in as far as creating fentanyl awareness. On September 20th, 2022, this was just last year, Governor Abbott charged state agencies to increase efforts to inform Texans of the prevalence of lethality of fentanyl. The Texas Education Agency is coordinating with our state agency partners to raise awareness about the impact of fentanyl in Texas to provide resources targeted to school personnel, students, and families who we serve. School systems can strategically collaborate with other community-based organizations in the statewide effort to prevent harm from this dangerous drug for school personnel, students, and other families. And we have a few stats here. Fentanyl is a synthetic opioid, which we heard was 50 to 100 times more potent than morphine, often lethal with as little as 2 milligrams. Okay, that's all you need for lethal, for something to happen, where you can die. Over 71,000 Americans died from fentanyl in 2021, an increase of 23% from the previous year. Over that same period, Texas saw an 89% increase in fentanyl-related fatalities, with provisional data showing 1,672 deaths in 2021 as compared to 883 in 2020. These are steep increases since in 2018 there were 214 fentanyl-related deaths in Texas. Drug traffickers disguise pills that include dangerous fentanyl to look like legitimate prescription drugs, and even candy to target children. So that's what's the scariest, right? When it targets our children. Fentanyl is impacting individuals with and without substance use disorders. Okay. Now here are just some. It's like a little reference guide to see if you see this in your child's or your student's phone and they're going back and forth and you see any of these emojis, it's cause for concern. So like we have here, like fake prescription drugs. And me as a parent, if I look at these, I wouldn't have thought, a second that it might be something about drugs. So we have this Percocet and oxycodone. This stands for Xanax, for Adderall, which is an ADHD medication. Dealer signals, dealing advertising. This means high potency. Universal for drugs is this leaf here. A large batch. I would think they're talking about just regular, cookies. Other drugs, meth, cough syrup, mushrooms, cocaine, heroin, MDMA, and mollies, and marijuana. So it just says here, this reference guide is intended to give parents, caregivers, and educators a better understanding of how emojis are being used to communicate about illegal drugs. Fake prescription pills, often laced with deadly fentanyl and methamphetamines, are often sold on social media and e-commerce platforms, making them available to anyone with a smartphone. Okay. And that is pretty much it. Yes.
Thank you. Does anyone have any questions? Comments? Anyone? Go ahead.
Yes, ma'am.
I have a question for you. I know that we do Red Ribbon Week, and it's like the kids dress up, and I know like all the kids like it and everything, but in the schools, do they actually, like on that day, do they talk about, okay, you dressed up as a superhero, because of this, like whatever it said, I don't know exactly what it said. but,
Yeah,
like,
let's
do they
look
go
at it.
over that in like every classroom or like every school? goes over
Yes, yes, they should be going over it in the classroom, and I guess age appropriate too, because you don't want to like scare them or whatever, right, like when they're little. But yes, they do, they're supposed to go over it, the teachers, and talk to the students about, drugs and how it's, I know, I'm going to wear pajamas, I know, yeah.
Elementary, like, oh, I don't want to wear my uniform, and, but do they have to,
Yes.
like, let them know?
Yes, they should, and they should be going into the classrooms too, like even before, like to talk to them about drugs and not only that, about bullying and vaping. I mean, we do have a lot of presentations where our counselors do go into the classrooms. They should be going into. But yes, they should address it as well.
Anyone else? Let's give Ms. Barrera, Ms. Gonzalez.
I'm just happy that I got to meet the other Michelle Barrera, because that was my, and I'm Michelle Barrera Gonzalez, yes. Well, nice to meet you.
Thank you, Ms. Gonzalez. To add to that question, Miss, as a parent, when I go to the campuses, when we visit campuses, sometimes our student activities coordinators or our administrators, when they're making announcements about the following week or the next day, they'll tell them, tomorrow is this day because of this reason. And so they're doing an all call. Teachers are also talking about it, and like I said, the counselors are also talking about it. But it is a crisis. This one, and I'll ask our students, guess which other topic is probably a crisis for teenagers? Yes, vaping, and that'll be one of our topics at our next committee meeting. Just this one meeting, what I always tell our coaches and our people, if you can go to a meeting or go to a clinic or go to a conference, and if you come away with one thing that you learned, you got a little better. And not to poke too much fun, but I need to stop using the cookie emoji. I just learned that today, because y'all were laughing over there. Y'all were laughing because I saw it. I send my staff or my daughters, and they'll say, "Dad, do you want anything from somewhere?" And I love the Chick-fil-A cookies, and so I'll send them a. And now I'm not going to, because they're probably thinking I use or something. So I just learned something today. Absolutely. In addition, before we move on to our next presenter, we do have, hopefully we have everyone's email address, and we can send you today's presentation and slides. We can send that to you a couple of days after the meeting once we record it and get our minutes. Okay? Our next presenter is from Region 1, and Ms. Marin is going to talk about present what Region 1 offers and is offering UISD for consideration. And also, with state law, we do have to go over human trafficking and human trafficking awareness and prevention. And this is just one of the programs that Region 1 is offering the district for the very near future. Okay? Ms. Marin.
Hello.
You're good right here. And it is,
right here.
there you go. Right click.
Okay, got it. Good morning. Again, my name is Arlene Marin, and I'm Education Director for Three Strands Global Foundation, which is working in partnership with Region 1 as we're rolling out the H-type grant, which we'll learn more about throughout this presentation. Again, like he mentioned, if you do have any questions throughout the presentation, feel free to stop me and ask, or we can just wait at the end. It's up to you. So, like I mentioned, the Human Trafficking Youth Prevention Education demonstration program is supported by the Administration of Children and Family, ACF, of the United States, Department of Health and Human Services, as part of a financial assistance award for Texas Education Service Center 1, totaling $500,000 for 5 years, with 100% funded by ACF HHS. So with other words, what this is saying, it's a grant that was given to Region 1, and your district is part of this grant. So what I'm presenting to you today will be free of charge and funded through this grant. What will be covered today is what human trafficking is, the need for prevention in ESC1, and the grant objectives. So what is human trafficking? Human trafficking is a crime involving the exploitation of someone for the purpose of compelled labor or a commercial sex act through the use of force, fraud, or coercion. Any case that involves a child under the age of 18 who is induced to perform a commercial sex act is a crime regardless if force, fraud, or coercion has occurred. In this slide, we also like to share that human smuggling is not the same thing as human trafficking. They are two different crimes, and although one can become part and victim of the other, they are not the same thing. Human trafficking, I know it says trafficking, so we always think like movement. There's some movement happening, but a lot of times there's not even a movement happening. It's happening right in the living room of your home, and you don't even know it. So when we bring this information to your district, the trainings, curriculum, as I'm gonna go through it, just keep that in mind. It's more of awareness and just education so that we can see what it really is and what can it look like. So just key statistics. Human trafficking is the third largest, fastest growing criminal enterprise globally. In 2021, a total of 3,534 human trafficking cases in Texas were reported to the National Human Trafficking Hotline. I also like to mention that this is just what was reported, but we have no idea of all those cases where nothing has been done. So although this is a large number, we can only imagine that it's a lot bigger than that. In 2020, Texas ranked second in human trafficking cases reported by state. So we can have like a look at Texas, and you see all the little red dots. That's really where the human trafficking is happening. And if we can see, we're like right there in the corner at the bottom, super red, which is our area. Human trafficking is complex and dynamic, which makes it difficult to see and report. So this has been it's been growing because it's very difficult and they can easily get away with it. As I mentioned before, a lot of things happen online. A lot of these connections are happening online, so it's very difficult to even see it happening, which again makes it difficult to report. The need for prevention. Traffickers are looking for vulnerabilities to exploit. So they look at the basic needs that our students and our community needs, and they fulfill those needs, and that's kind of how they get them, to trust them. And based on our region, this is the vulnerabilities that we have. We have students that are in foster care. One of the big ones, it's property, right? Sometimes some of our students are needing those basic needs, just food, water, shelter, and they take advantage of that. They take advantage of the fact that they need those basic needs. They fulfill those, they become their friends, and then they start with the process of the trafficking. HTIP grant objectives. So why are we here? And what are we offering to your district and to your staff and to your students? So through the grant, we have three main components. One is bringing a protocol to your district to report human trafficking. So we're going to be working with your district, with administrators to put together a protocol, and so that we can have that implemented within your district. We bring training for your staff. We will train your staff so they can then turn around and train the rest of the staff. And then we roll out a curriculum for students. Because sometimes when it comes to awareness, our staff know it, our parents know it, but what about our students? Because ultimately, those are the victims. Those are the ones that are going through it. Those are the kids that need to speak up. So under the Texas Education Code, a TEA amended its child abuse prevention mandatory reporting and educator training requirements to include human trafficking in alignment with updates to Texas law concerning the definition of child abuse and neglect. Texas school districts are required to implement a protocol to address sexual abuse, which includes human trafficking, and participating training on preventing and recognizing sexual abuse and exploitation. This program provides both the protocol and the training so that the districts have a clear pathways to meeting these requirements. In other words, this is a requirement for TEA, and this program really brings both of those requirements to your districts. What is the PROTECT program? So the PROTECT program is a skills-building human trafficking prevention education program for children and adults. The program addresses the 15 characteristics of an effective health curriculum and empowers young people to recognize and respond safely to different forms of violence, including human trafficking. Through a comprehensive training called the Journey to Protect, school staff are learning how to recognize, report, and respond to suspected cases of human trafficking using a trauma-informed healing center approach. Again, this is what I shared about the protocol. So in creating the protocol, it was developed with the coordinated community response, stakeholders from law enforcement, CPS was involved, educators, social workers, healthcare professionals have all contributed time and resources building the comprehensive trauma-informed protocols that we are not presenting to your district. So we have a whole team behind the scenes that has worked in this, and now we come to your district, we work directly with your district so that this protocol can really be used. Because a lot of times we have all these papers and protocols, and what does it matter if we have it if it doesn't even fit our district? So we work directly with your district so that this can fit a lot of the protocols you already have, and we can just kind of tweak it so that it can be user-friendly, in other words. All lessons taught in Texas districts must meet Texas Essential Knowledge and Skills, TEKS. The PROTECT program is aligned with all the required TEKS, and each piece of the TEKS and TEK align. From the adult TEKS training to the student education, all pieces of the programs meet standard necessary for district lessons. Now, why are we presenting this at the SHAC meeting? It's because of Senate Bill 9 overview. So as of September, all material related to sexual violence, domestic violence, dating violence, and sex trafficking must meet all the requirements as outlined by Senate 9. This bill also requires policy for protocol and training for schools. The curriculum must be approved by district SHAC as well as have the opt-in structure. For example, they have to opt in into our curriculum. We're gonna send out a notification to parents, and they have to allow their students to participate in this program. If they don't want their children to participate, that's not a problem. Or if at any time during the rollout of the curriculum, if they decide that they don't want their children to participate anymore, they are more than welcome to remove them from the lesson. So I will jump now to the actual program. This is what your staff will be getting: Human Trafficking 101, Human Trafficking 102, and Human Trafficking 103. And 101, they will learn about human trafficking, and they will also learn about the role of technology and tactics used online. Participants will also learn about the barriers that keep victims from identifying their exploitation. In 102, participants will learn how to be trauma-informed, shifting our approach from what's wrong with you to what happened to you. So this is very, very important, because sometimes we go out there and we see cases, and we can be very judgmental based on what we've seen or our experience, and just ask, like, why did they leave? Why did they reply? Why? But it's important to kind of take a step back and see it from a different perspective, especially when it comes to staff. There's a lot of things going on, and you might just see a troubled child, but there's a whole story behind that. So it's important to also share that with the staff. And finally, in 103, they will learn about recognizing it, reporting it, and the protocol. This is what the curriculum would look like. And the curriculum will only be rolled out to 5th graders, 8th graders, and 11th graders. Because of the grant. That's just how the grant was written. So only those grade levels will be getting this curriculum. Let me go back real quick. For elementary, we talk about safe people, safe places, and safe choices. So this curriculum teaches students about the foundation meaning of safety and includes activities that prompts them to consider what their safe circle looks like, online and in real life. They will learn about a safe touch versus an unsafe or unwanted touch, helpful resources, and how to create a safety plan. In protecting a masterpiece, that's for your middle school. The curriculum teaches students about personal safety and empowers them to see their self-worth and potential. They learn about the forms of abuse and human trafficking, the signs of grooming, and how to access resources that can help them keep safe. And for high school, we talk about forms of human trafficking, the importance of their rights, and as well as how to advocate for themselves and others. They will be encouraged to build their resilience through activities and strategies that will help them thrive in their workplace and beyond. So we understand that in high school, around this age, that's when they start looking for jobs and join the workforce. So this lesson really explains to them what their rights are, what's allowed, how to look for a real job, because nowadays everything's online, right? So you can go online and apply, and what if this is not even a real job? So we go through a lot of that with our high school students. Here's a graph of the curriculum and of the concepts. So our curriculum is age appropriate, and although we have the same concepts, they're presented in different ways. So for example, the inner voice is presented different to elementary, middle school, and high school, and it's just very age appropriate. And as you can see, on the left, you have the concepts, and then on the right, well, my right, you'll see that they kind of overlap. The only concepts that we don't have in middle school and high school would be the child abuse and human trafficking, but then, for elementary, but middle school and high school includes those topics. These are only two lessons, two 45-minute lessons to our students. So the way it works is we would come in, every staff member would be trained on what to look for, the red flags, how to report it, and after everybody's trained, then we would start rolling out curriculum. And again, it's only two lessons of 45 minutes. This is what the elementary curriculum looks like. They will learn what safety means, personal boundaries, the inner voice, trusted adults, and safe circles, both in person and online. In lesson 2, students will learn about the concept of vulnerability, protective shields, different types of touch, resources for support, and safety planning. Our curriculum includes activities, it includes posters, videos, so those like heavy topics, they're animated and they're very age appropriate for the students. So for example, in the elementary school, they're gonna learn about the safe people, safe places, safe choices, and we have them do an activity of, in your safe circle, who's your safe circle? Who are the people that you can trust? Because a lot of times we'll tell our students, you need to go tell, an adult, but what if they're not a trusted adult? So who are these people that are in their circles that they can go to? Who are my safe people online? How do I know that they're safe people online? How do I recognize that? And what are my safe spaces and my safe places? Like, where can I go? If something's happening, where do I go? What do I do? Who do I talk to? What resource do I have? So this is kind of what we talk to for elementary. We really don't go into depth on human trafficking, but more of creating those skills that are gonna help them if a situation comes up. For middle school, we talk about what a masterpiece is, their inner voice, healthy relationships, forms of abuse, trusted adults, being an upstander, and in lesson 2, again, about personal boundaries, human rights, the grooming, signs of abusing human trafficking, and safety planning. So this is some of the examples of the curriculum. We talk about secrets and surprises. How do we know that it's a safe secret or a surprise? What a safe secret looks like and what a not safe secret looks like. And if somebody sharing with us an unsafe secret, what do I do? Who do I go to? So a lot of the curriculum happens where we share information, we watch a video, and then we apply it. How would we apply that to our life? Because we think that we know when they share that, but when it's actually happening, what are we gonna do? So a lot of our curriculums comes with that, with practice. You know, if we're in this situation, how would we practice what we just learned? How are we gonna say no? How are you gonna reach out for help? And this is what our high school curriculum looks like. They'll learn about resilience, human rights, vulnerability, human trafficking, safety planning, their inner voice, protective skills and resources, how to take a stand, possible signs of human trafficking, the role of technology, and red flags and employment opportunities. This is an example of what the high school curriculum looks like. Safety plan, you know, again, how do we create a safety plan? When an unsafe or uncomfortable thing happens, what do I do? These are questions that we're asking our students. What are you gonna do? If this happens, what are you gonna do? And what resources do you have available? So how do we know that our PROTECT program works? We have our students and our staff take a survey before and after. What did they know before, and what have they learned after, and how is that applied to their lives? And I'm gonna play this video really quick.
I didn't realize that human trafficking happened here in our own hometown, Fort Worth, Texas. Who would have thought?
I did not know that children in elementary school was being exploited. And I always had the mind that I wanted to protect the children, but I didn't know what they were going through.
Human trafficking exists in every community. It is not just a problem that happens overseas, and we need to end it. Three Strands Global Foundation is on a path and a mission to make sure that that happens. And the PROTECT program helps to keep communities safe. We make sure that our teachers and our students are educated and trained so that they can thrive. The biggest barrier to discussing human trafficking in schools is the denial that it's happening locally.
Fort Worth is a human trafficking hub. Our students, as I say, are very naive and trusting. This PROTECT program provided safety for them so that they would inadvertently get into situations that were dangerous.
With the PROTECT curriculum, I was able to make sure I gave the kids warning signs and things for them to look out for as they are growing up, so that they will be protected from things that could happen.
I like to think that they feel that they can speak up and have a voice now. Personal boundary skills, personal space, how to say no, and also I feel that I embrace it as well, and I model what I teach.
Having a curriculum that was designed and had input from survivors of trafficking is so very helpful, because I know they had experiences at the same age, and what is it as an educator that we missed? A child would have never gone into trafficking.
It will make a difference in student engagement in the classroom, and it will ensure that their students are safe so that they can come to school every day and learn academics and be emotionally sound.
More than half of our students are Spanish-speaking population. Having the curriculum in 2 languages assures that we are getting the message across in a way that they can understand. After the pandemic, we had to be adaptable. We had to actually adapt to kids not being in the classroom. And online safety we knew was really important. We saw numbers in the US skyrocket of kids who were being exploited online.
When we were doing the curriculum, one of the students indicated that someone was trying to engage with her online, asked her questions about where she lived and how old she was. We got that shut down, very, 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 very quickly. And that's because we just made the right intervention at the right time.
Every time that we have done a PROTECT presentation, there has been at least one outcry. We were able to work with that student, get some services. They saw themselves in the PROTECT curriculum and felt comfortable enough to say, this is not right, and let me tell somebody. The PROTECT program is more than awareness. It's really primary and secondary prevention. It's important that we build skills in our youth and our children, that they understand and role play how to actually keep themselves safe and protected. When we focus on the children, then what happens is that not only are we protecting them from human trafficking and exploitation, but potentially from bullying and suicide. There's a lot of things that have come out of the Protect program being scaled throughout the United States.
I believe that Protect is one of the best curriculums that I have ever taught. I feel like I'm giving them those tools that I wanted to give them, but I didn't have the foundation for it. I feel that it is going to save so many of our children, and I believe it is going to make a great impact on their life.
Just to summarize, really what we're here to do is to provide resources to save our children and keep them safe, and just giving them those tools to look out for each other. Because as much as we would want to be there for them 24/7, as a mom, it's difficult not to be there, right? You send them to school, and then you hope that they're hanging out with the right people. You hope that they know how to say no. You hope that they have the skills that you've given them. So this is just kind of reminding them, this is within you. And just to kind of look out for each other, because ultimately, I know we have students here, you guys look out for each other. And you guys need to just take care of each other, because at the end, mama stays home, and daddy's working, and you guys are there for each other. So just providing those skills for them, and as well the training for the staff. Questions or feedback? Yes, ma'am.
Would this ever be available for the parents?
So we do have a parent caregiver training as well. I didn't add that to our present. I just thought about that. We were talking about it. I said, I forgot to add that. But we also have that component. So it is a community program. And we do involve parents as well, and what to look for, how to talk to them, what resource you have available as a parent. So yes, we do have that available too. Any questions, concerns?
Any other questions?
No?
Anyone else?
Okay.
Thank y'all. Let's give her a hand. Right.
And so right now, currently, do we have something that's similar to that?
It's a good question. So last year, 2 years ago, we updated our health curriculum. And our district has 2 athletics / PE coordinators. Mr. Jose Briones back there. Coach, if you could stand up. Mr. Briones is our athletics coordinator, and he also oversees secondary physical education and grades 6 through 12. And Ms. Roxanne Robledo also is one of our PE coordinators, health coordinators as well, was a health teacher at United South for many years. She oversees elementary physical education. And so 2 years ago, we updated our curriculum, and it's very detailed. It's 36 weeks? 36 weeks. Okay. Coach, can you expand a little bit on what they do at the secondary level?
Yeah, so a couple of years ago, actually Coach Boteo
Does the high school.
does our high school health, and he noticed that our health was outdated. So we went out for to update our textbooks, which we did. And with that, the Senate bill and the House bill, we need to include the sensitive topics, which are human sexuality. At the junior high level, at the middle school, we have it for 6th and 7th grade. And we push that to the end to kind of let those middle schoolers kind of mature as the year goes, and the teacher and the students can develop a relationship. So at the beginning of the year, we send out a notification that we're going to be talking about this as we get closer. And then 14 days before, this is the same for middle school and high school, 14 days before we send a second notice, and the parent has to consent to these lessons, which include human trafficking, fentanyl, all other sensitive topics which we have broken down. These were already approved by the SHAC, and they are also approved by the school board, brought several times. So a lot of the things that you saw, we do cover some of these things, I think at all levels.
Elementary, Ms. Robles?
So for the elementary, I oversee the elementary, and we have the same topics. Ours are spread out throughout the year. We start with our topics from first grade. The only topic we cover in first grade is safe and unsafe touch, because all our curriculum is aligned with the TEKS. So we're following whatever the state mandates are, that's what we're following. So we have a couple of lessons throughout first grade through fifth grade. Fifth grade is where we really start covering the human sexuality, and our nurses cover that program, and we cover the trafficking. So that's what we do in the fifth grade level. And as far as the other grade levels, they go over gangs, they go over your personal safety. If you see something, who do you report it to? In prior, it's like report it to a teacher, report it to a parent, but sometimes those are the ones who are the abusers. So it's find a trusted adult. So all our curriculum, they're age appropriate. They have the curriculum that we use is Quaver, and it does come with interactive, with questions. All our elementary campuses have smart boards right now, so this is a great opportunity for our coaches to implement their health lesson. Again, like Coach Briones said, we do send out a letter at the beginning of the year, and it states what we're going to be covering, and then 14 days prior to the actual lesson, the parents will get another notice and they will sign the permission slip. If the parent does not bring back the form, it is automatically, we opt them out, and we don't want them to participate in those lessons. But those kids are not sent away. They have another health lesson to take place of that lesson if they're not covering that. So we have been covering it. This is our second year. And on these sensitive topics, we do have our counselors go in there, or an administrator go in there, because as our coaches are giving the lessons, our counselors there's an outcry that the counselor knows who do we look at, who can we help out. If we notice something, our counselors are there as a support system. Our nurses are also there as a support system, because we want to give our students all the opportunities they can to come out, because we want them to feel safe at our campuses and know that they have trusted people with UISD.
Thank you. And at the high school, Coach Botel, briefly?
Yeah, I oversee the high school, and we're in the 9th week. We're in 9 weeks, okay? And like Mr. Briones emphasized, we do send out the permission, the introduction letter that we are going to cover these teen dating and violence. We are going to cover trafficking. We are going to have human sexuality. And talking to some of the teachers right now, we're getting 90% of these permission slips back. So it is working. The kids want to learn on some of these topics and stuff like that. And again, like Mr. Briones mentioned earlier, we did adopt a book, and the curriculum it's student centered. It's got all the information in there, and it's working well. It's working well. Just to let you guys know. But we are in the 9 weeks. For us, we're in the 9 weeks at the high school level. And we're providing all the information with the new bills and the House bills. We're providing all the information that needs to be provided. We're following all the laws.
Thank you, Coach.
So we also have it available in Spanish as well.
Okay. So, Mr. Ramirez, good question. Thank you. Pre-COVID, a lot of this was not updated in our health curriculum, our health and PE curriculum. Post-COVID, and with these three, the research that they did, and several years ago before that, the book that we brought, the curriculum that we brought, and it's an online curriculum, so any type of new vaping updates or fentanyl updates or domestic violence, teen dating violence, any type of updates, it goes automatically up into our curriculum, and our coaches and teachers can use it. And that was one of the best things that they did, is to update our curriculum that way. But thank you for your question. Y'all, our goal was to get you out at 1 o'clock, and we're right on target. Are there any questions about today, and or our possible next meeting will be in December. Okay, definitely our next meeting, we'll try to have at least 2 to 3 topics, depending on the popularity of it or what people want to hear. or what our students want to hear, or what parents want to hear, definitely is going to be Ms. Duarte. And she was voluntold. Actually, I just put her on the committee because she works for the city of Laredo. And she's also going to introduce a potential curriculum called Catch My Breath. And it's all vaping. Okay, so that'll be our next topic. Students, I appreciate y'all being here. Parents, I appreciate you being here. We hope that you stick with us because we do value your input and we do want to hear from you. If you have any thoughts, any ideas, or anything on policy that that you want to see, please feel free to let us know. Okay? That being said, we are adjourned for today. If you hadn't got some lunch, please help yourself to some lunch. Don't send out any emoji cookies. And I just learned that today. Thank you all so much. Appreciate you.